Our next presenter is Dr. Patrick Foong, who's from the School of Law, and Patrick's topic is regulating stem cell research and therapy. Thanks very much, Patrick.
Good afternoon, ladies and gentlemen. My research is in the regulation of stem cell research and therapy. My research helps in raising awareness of the controversial issues surrounding stem cell research and the severe problems associated with untested stem cell therapies that's been provided by clinics in overseas. For example, some types of stem cell research is very controversial, such as embryonic stem cell research, as this research involves the destruction of the human embryo. As for untested stem cell therapies, this means the use of stem cells in patients which is yet to be tested in clinical trials. And some patients have actually reported suffering from adverse effects after receiving these stem cell-based therapies. Stem cell tourism is a serious problem. This is where acute patients, especially the very ill, they travel to other countries to seek such stem cell-based treatments. There have been reports of baseless claims of cures, charlatans, and adverse medical events, and this includes deaths. Now, most of these treatments are experimental stage, and most of them are unregulated. Now, I want to stress that stem cell tourism is a prudential calculation for the individual, and the state has a moral obligation to actually inform the citizens about the potential risks of actually receiving this kind of treatment. So it's very important to have guidelines, because guidelines will raise awareness of these particular issues very effectively. In fact, it's very important, guidelines, policies, and the law. Now, it's very important for regulators to set up effective regulatory model in order to regulate this kind of treatments within the country. Indeed, it's important to actually have measures to control and to mitigate the situation. I'm an early career researcher in ECR, and I'm excited about the impact I hope to create in the future. First, I'm going to begin by mentioning the impact I've created so far, which is I'm a regular contributor to The Conversation, which is a media outlet. The publications in this conversation have created some impact, and they have been cited, tweeted, and disseminated on social networking sites like Facebook, LinkedIn, and Twitter. And they were republished on various websites, including Arthritis Queensland, The Australian Doctor, Medical Observer, View Magazine, Ethics and Health Law News, and Breaking 100 News. And they also appear on the Australian Parliament website and in the Altmetrics Explorer, where one's research can be tracked. Also, that led to an interview with the Healthy Mummy, which is a social media platform for 1.1 million Australian mothers. As I build my research profile in future, I intend to be actively involved in the various stem cell organizations, both national and international. That will include Stem Cells Australia, and there's also the ISCR, which is the International Stem Cell Organization. There's also the Singapore Stem Cell Society, as well as the Australasian Association of Bioethics and Health Law. I look forward to the day where I'll be involved in the ethics committees of these various organizations, where I can actually provide my input, and we can discuss and explore various effective policies, guidelines, and laws to effectively govern untested stem cell therapies. Indeed, these guidelines got to incorporate some fundamental ethical concepts, such as the primacy of welfare, transparency, and respect for research subjects. My research can actually impact on the patients and their families' decision-making whether to pursue these untested stem cell therapies in overseas. My research is of regional, national, and international impact. And the beneficiaries of my research would include the patients and carers, doctors, clinicians, scientists, and of course every concerned citizen on this planet. Thank you.
Thanks very much, Patrick. A question from Jill. No? You could,
I'd like to ask a question about ethics.
Yes.
So imagine that I have a disease. My only hope of curing it at the moment is experimental stem cell therapy. From my point of view, where is the ethics in the fact that I have a regulator who is risk averse and cautious and stops me making the decisions about my body, which I want to make? In other words, that I am willing to take the risk of that, and instead is now forcing me to go overseas to do it.
Okay. In 1 minute. Oh, this is an excellent question. I believe in the patient autonomy as an entirely up to the patient who decide to take the risk. The focus of my research is more of the governance of these stem cell treatments, so much so that the patient got to be given informed, rather they provide sufficient information before they can provide informed consent. Yeah, I hope that. Do you want me to elaborate on that?
No, I think you're very
it's, I think, like all of the presentations that have been done today, they invite questions that we would all like to discuss for quite a long time. So thanks very much indeed, Patrick.
Thank you.